This is what I would say to the provider. The patient presented to the clinic with signs of severe abdominal pain and accompanying fever. The patient noted that they have been having hematochezia for the past few days. The patient has a family history of IBS, but the patient has never been tested for it. Physical examination showed abdominal bloating that was painful when pressure was applied. The CBC came back with high WBC and normal RBC indicating infection, but anemia was ruled out. Liver functions came back as normal, and the PPD test came back negative for TB. Examination of the patient's stool for possible infection came back negative, though a called blood test came back as positive. After conducting a colonoscopy, multiple colorectal carcinomas and large deep ulcers were found, as well as impacted segmental involvement of the mucosa was seen. Biopsy was conducted on the ileum, colon, and the rectum, and tested and came back positive for granuloma clusters. ASCA and PANCA tests were run with ASCA coming back positive and PANCA tests coming back negative, indicating higher likelihood of CD over UC. Surgical intervention is not recommended at this time. Suggested management of symptoms includes a prescription of corticosteroids as well as an antidiarrheal and analgesic. It is also recommended to offer vitamins and mineral supplements due to the severity of the inflammation. If the patient still has persistent symptoms, a prescription of immunosuppressant or biologic is recommended to reduce any further inflammation. A progress check within the next few months is recommended as well to discuss any possible changes to the treatment plan. What I would say to the patient would be, Crohn's disease is something we believe to be caused by genetics. After running many tests, we believe that this is most likely what you have, considering your family history as well. Typically, if you have a history of IBS in your family, it is more likely that you may develop it as well later in life. Crohn's disease causes your immune cells to attack the cells in your intestines, which makes the intestinal tissue inflamed and decreases your ability to digest your food. This can lead to other symptoms like your abdominal pain, bloating, and diarrhea. Unfortunately, there is no cure yet available for this disease, but we're going to put you on a management plan to help alleviate your symptoms. I will be prescribing you a corticosteroid to help lower the inflammation in your intestines to start out, though if you find your symptoms are still persisting, we can switch you to an immunosuppressant or a biologic to see if that would work. Along with the anti-inflammatory medication, I will be prescribing you some antidiarrheal and an analgesic to help you with your stool and your pain management, respectively. We can try these medications, and I'll have you check back in once the medications have had time to kick in.